One ship, 149 people, more than 20 countries, and the border holding wasn't the point. Was anyone watching the door when they walked through it? This is Hantavirus Watch. Today, why officials moved people off a hantavirus-hit cruise ship and into 24 countries instead of holding the line on board, and whether that decision kept the risk from traveling with them.
One tap on follow, and we'll be back in your ears before you know it.
The Indian Express with Virender Singh Chauhan.
Recent episodes involving cases of Ebola, hantavirus, and Nipah virus show that dangerous zoonotic infections are no longer rare, isolated events. They are appearing with increasing regularity at the interface of humans, animals, forests, farms, hospitals, and global travel. These outbreaks are not only scientific events, they also expose weaknesses in surveillance, public trust, vaccine access, and international preparedness.
The Indian Express has an expert piece today from Virender Singh Chauhan, framing Ebola, hantavirus, and Nipah as a recurring pattern that needs a response plan before the crisis hits. Fair, as far as it goes. The Hondius case is more specific. Andes virus, human-to-human transmission, a vessel mid-ocean, no port access. That exact scenario doesn't show up in most preparedness playbooks.
Viruses don't respect borders. Okay, but on the Hondius, nobody had to slip past one. More than 24 passengers walked off the ship on April 24th with no contact tracing, almost 2 weeks after the first death on board.
Right, and that gap happened under the system we already have. Nobody needs a new treaty to explain why notification failed for those passengers. WHO can coordinate, it can't enforce at the gangway.
So when the expert calls for infrastructure built in advance, measure that against the record. If you were one of the 149 who landed in a country with thin hantavirus surveillance, who was your point of contact? And did they even know what Andes virus looked like?
That's the honest read on the cliché. Chauhan's right that these zoonotic spillovers are getting more frequent. Animals, farms, travel, all colliding. But the Hondius gives us a sharper map of the failure points, what held, what didn't, and where the handoff broke. That's more useful than another general call for cooperation.
Okay, so instinct says keep everyone together, contain the threat, but officials chose to move 149 people off the MV Hondius and scatter them across more than 20 countries. What's the logic? And how do you do that without just spreading the outbreak?
That's the tension exactly. The answer is partly about what the ship couldn't provide, and partly about what kind of risk officials thought they were dealing with. The MV Hondius was anchored off Cape Verde, and Cape Verde wasn't letting it dock, so critically ill patients couldn't get the level of care they needed. In the WHO's disease outbreak news on May 4th, the count was already 3 deaths, 1 critically ill patient, and 147 passengers and crew on board from dozens of countries. You can't run intensive care forever from an anchored cruise ship. So Spain agreed to receive the vessel at Tenerife, in the Canary Islands. From there, the ECDC drew the distinction that drove the whole operation. People with symptoms got priority for medical assessment and possible medical evacuation. People without symptoms were still treated as high-risk contacts as a precaution, but they were sent home on specially arranged transport, not regular commercial flights. That no commercial flights rule is the central safeguard. The BBC reported that the 18 American passengers, for example, flew home on a U.S. government-chartered plane, with most sent to the University of Nebraska Medical Center in Omaha for screening. And the ECDC gave specific PPE guidance for anyone handling disembarkation and transfer: gloves, gowns, FFP2 respirators, eye protection. Because the evacuation had to run as a controlled medical operation rather than routine passenger offloading.
But once those passengers landed in 22 plus different countries, how are officials even keeping track of who might still develop symptoms?
That's why this gets so messy operationally. El País reported that Spain alone had to coordinate repatriation talks with 22 different national governments at the same time, each with its own quarantine arrangements. The ECDC guidance is pretty straightforward. Classify contacts by exposure level, monitor them, test accordingly, and if symptoms develop, get medical assessment instead of waiting it out. For listeners, if you or someone you know was aboard the Hondius, contact your local health department or a clinician right away. Don't self-manage. And watch for the early warning signs officials are calling out: fever and rapid respiratory deterioration.
If Hantavirus Watch helps you track outbreak risks, try Ebola Watch, a daily briefing on the Ebola outbreak in DRC and Uganda, with case counts, border tracing, WHO vaccine news, and traveler guidance. Find it wherever you listen to podcasts. We've put links to every story from today's briefing in the show notes. If something caught your attention, you can follow it there and read a little deeper. That's Hantavirus Watch for today. This is a Lantern podcast.